All right, it's April 14th, 6 o'clock. We're having a meeting of the Board of Health via Zoom conferencing. Present is Casey Mellon. We've got Teresa Delete and Glenn French Chair. And joining us this evening is Chief Parente. I got all those, we're going to start the meeting. All those in favor?
Aye.
Aye.
All right,
Glenn,
we're official.
Glenn, you missed Swati. You missed
Oh,
Swati
I
too.
didn't see Swati.
That's
Yeah.
okay.
He's definitely here.
Ah,
She's here.
I'm sorry,
we're all here.
Swati.
That's
It hasn't
okay.
popped
That's
up
fine.
yet.
Yeah, yeah. No, that's
Oh,
fine.
okay. Oh, there you are. I'm sorry.
No, that's fine.
We're ready to go.
Go ahead, Casey.
Casey?
Yeah, well, you want to go down the meeting agenda I sent out for everybody. The first would be consideration of the January 12th minutes, review correspondence, any old business that may be required of the Board of Health. So I did send out all the old minutes from January for review. So that would be the first.
I think we're going to skip over that since we have the chief on Zoom right now. Let's start with the coronavirus pandemic and how the town is doing and see what the chief has to say. How's that sound?
Okay. Should I go first, or do you prefer the chief? Or
I'm just running the meeting, Glenn. I'm here if you have questions, but I'm hosting the Zoom thing because apparently I'm the technical guy.
All right.
I'm the technology guy. So
all right,
you go ahead and do your meeting however you want.
Well, Casey, why don't you give us a rundown of what's happening in the town with regards to the Board of Health and the coronavirus and cases and that kind of thing.
Okay. It might be a good idea just to have everybody introduce themselves. I don't know if I'm Casey Mellon. I'm the health agent. I've been here for about a little over 2 years. If you want to just go around and introduce yourselves.
All right. My name's Glenn French. I'm chair of the Board of Health.
My name's Dilip Jain. I've been a member of the Board of Health for over 10 years now.
I'm Swati Sane, a Board of Health member for about 3 years now.
Teresa Capobianco, Board of Health member for just a few months, previously served on the planning board for many years.
And I'm Dave Parente, Fire Chief, Emergency Management Director.
All right, very good. I'll give an update on the state of the town regarding COVID-19 activities and whatnot. As of right now, as of yesterday, there's over almost 27,000 cases in Massachusetts for COVID-19, and there's about 2,128 in Worcester County, including 844 deaths in the state. There are 49 confirmed cases in Northborough, and 24 of those are recovered. The age groups are also given on the website, what have you. No real surprises. Not many on the young side, some are on the older, but that information's up there. As we all know, this is primarily a medical emergency. The heart and soul, as far as the local Board of Health are concerned, is tracking and tracing the cases. We have a Board of Health nurse. She works for the VNA. Her name is Ann Labont. She's been working tirelessly to deal with tracking and tracing all the cases. She's been working 7 days a week, often many times 12 plus hours. The good news with her is she now has help. She has, there's 9 students, nursing students that are going to be helping out with her to kind of do some of the easier, less technical aspects of the tracking and what have you. This started this week. So she's still in charge. She's the case nurse for our town, but she's getting some help with doing more of the day-to-day kind of monotonous activities. So tracing and tracking can be very difficult and time-consuming. I speak with her daily. We make sure that all of our numbers and that we're all on the same page, and we update ourselves every day of what's going on and what issues she may be having, what have you. It's important to stress that she's working through Maven. This is a tracking system, the Massachusetts Virtual Epidemiologic Network, and it's working well, but there are gaps, and then there's a lot of it's time spent on just going through and finding those missing pieces of data, just to to keep going with the program and what have you, going with the tracing. Let me see. On my level, the first few weeks were primarily, I sent out the original 4 or 5 notices to the town, just interpreting what DPH, the information coming up from DPH and CDC, and that was the initial response on my part. And I'll go back to a little bit on those first few weeks, but it was clear by late March or so, early April, that this was obviously going to be a much bigger issue. So the town, it was more of a town-wide. We kind of united as a town per se. We started having weekly task force meetings to kind of go over service that we would need to provide if the situation were to progress, plans for staffing, school closings. How we meet with the superintendent of the schools. Like our task meetings consisted of myself, the town manager, the fire and police chief, the superintendent of the schools, and a few other department like DPW and what have you. We would discuss any emergency preparedness issues, to work on. The senior center was also on these meetings to deal with anything they may have on their end. And this was initially for these, so now we have we have a task force, so to speak, and we're going through these every week. Early last week, perhaps maybe a little bit closer to 2 weeks ago, we did update the website. After kind of having everything kind of set in place, we updated it and changed the format, because before it was just, an update for myself, an update from the schools, an update of resources and what have you. But it really is much more streamlined now. Now, when you go on this website, you see my updates, you see the numbers, the daily numbers are updated. Now there's resources from the school. The school has their own link. There's resource for economic resources for those who may be in need of meals and what have you. What services are those, like you who may be a recluse in the home or what have you, or don't have access to transportation. Various resources that the residents may need. My main role with this is obviously at this point is just to keep up with the number and case information, update the website, and to make sure that the number, everything we're presenting on the website is accurate and what have you. The town in general has responded very well. I mean, we were on this from the get-go. I think the organization and the information we present is better than average compared to most of the towns, and they're doing well too. I'm not criticizing them, but I think we really go beyond that. Some of the other points too is, there's a lot of update. Not a lot of them now so much, but there's updates from the governor's office and from DPH. I've gone out on many occasions to make sure that places were initially closed that were supposed to be closed. I think I knocked on a good 100+ doors. Also, and just recently with the masks, there was recommended on, I believe it was April 10th, it might have been the 11th, I believe it was the 10th, that people should be wearing masks when they're out in public, and that includes the workers and what have you. And just yesterday, I went to, I didn't go to all the places. I went to the larger ones where crowds might be an issue, and updated them, give them the information. And the good thing is they're already on it. They're all, they have masks. They have masks that are on order. They have crowd control and what have you. Some of the smaller points on my end, I have a few other ones, is that with Ann, she's a VNA with 9 communities, and we also have a smaller group of those 9 communities that we meet. We have Zoom meetings probably twice a week, once or twice a week, and we discuss any issues with the student, not issues, but how things are going with the new students and how they're transitioning into their role of helping out, and the Board of Health nurse. I did receive a grant, or not a grant, I'm sorry. The governor released $50 million for local boards of health. I applied and I got 16,000. I asked for 20. I got 20. I got 16,000, and this can be used for any sort of supplies or resources, and the chief may discuss a little about on his end. It could be used if someone needs to be quarantined, like a first responder, to pay for the hotel that they may stay at.
Right.
I'm not so much an expert per se on that, but the money is there if it's needed, for that sort of expense. Yeah, so I think that's pretty much a bit more on my end. That's all the activities have been very busy. I've been coming to work for still coming to work every day here, minus Fridays when the town hall is closed.
Right.
I have my computer at home. I'm still doing work from home as far as updating information. Basic outside of COVID, I still do have some basic responsibilities with the septic systems. I know I'm getting a little off, but I figured this is part of my a combined number 2 and 3. So any of the septics and wells, I'm still completing. Is there any sort of nuisance or foodborne illness complaints? I'm still doing. Haven't had any of those, luckily, but I am here for that. No routine inspections, just for safety purposes. Yeah, so that's kind of it on my end. I don't know if you have any comment or you want to have any statements or what have you, but that's kind of what I've been doing on my end. I think we're doing everything we're being recommended to do by DPH and so forth.
Right.
Yeah, so I don't. Okay.
So
Yes, that's
Massachusetts, the only state right now that's actually doing this tracking.
Oh no, this is going through nationally. I mean, we may have a different name, but this is yeah. So
I thought Governor Baker was on saying we're the only ones who were doing this tracking, and
that's simply not true. Yeah, they have to.
I think he's referring to the program, to the software program, and the way they're actually doing it and getting the information back out to first responders.
Okay.
The Mass is unique with some of the stuff that some of the processes they've put in place. Not the fact that everyone's tracking, but some of the processes that Mass has put in place is unique, or are unique.
Casey, a good question
Yep.
for you. How's Ann and her team reaching out? I mean, it's basically by phone call because they can't be going door to door. I mean, I don't think that would be.
No. How Maven works, and again, the heart of all of this, and I think I explained this to many folks. It is the heart of all this is people have to they volunteer to do this. They need to do what's right. There's no way to police the whole state or the whole country, what have you. People have to use their good judgment and do what's right. The tracking is, they receive the case from the state. There's a positive test, and she gets that into her system. So she calls. Most of it's primarily calling, whatever contact. She calls them twice a day. Records what temperature they're taking. That's key. See if they're how they're doing with their fever and what have you. But this is all by phone primarily. In theory,
Okay.
if there was somebody, I could be involved if somebody wasn't being in touch, but that hasn't been the case. Everything has been going smoothly, but it is all primarily by phone.
Okay.
What
And
about sorry, Delete, go ahead.
Have the grocery stores also implemented certain restrictions? I know they've created hours when people over 60 can go, but have they also started initiating one-way aisles and putting tape down for 6 feet distancing, plastic shields for the cashiers, all the stores,
we have 3 I would consider large businesses, and I was there. I've been to all of them several times, as a matter of fact, kind of giving as I get more information from or recommendations from the state. They are all pretty much doing what you just described. The masks, employees have masks. There's tape to guide the people to keep them away from each other. Some places are actually putting barriers and plastic, like shields in front of the cashiers and what have you.
Yeah.
So the bigger places in town are definitely on it.
Okay.
So Governor Baker came down with an order to reduce occupancies in grocery stores to 40% of their normal capacity. They then came out and asked us as communities to not restrict that any further. So if a community wanted to say, no, we want you to have only 25% capacity. The governor said no, 40%, and we're going to use masks, and we're going to try and, as you said, to keep them in using arrows to keep them going in certain directions. That has worked out very well, especially Wegmans. I've been there to check on them, and I know Casey's been there. So that's worked out very well.
Yeah,
Casey,
I was just
go ahead.
I was just at Wegmans yesterday. I was actually at all the major ones, and I even went to a few of the few restaurants that were open. Many of them are closed, and many of them, I mean, they have maybe 2 employees, and I mean, I couldn't go to all one. I think we have like close to 90 food establishments. So I was hitting the big ones that would have crowd issues, potential crowd issues, and they're all on top of it. They all have their procedures and what have you. So so I think that's going well. I think from my permanent businesses, they've all responded well. I haven't had any issues. I've been getting a lot of questions from the public regarding, and there's some confusion about non-essential and essential businesses, but the ones that there's a lot of businesses still open because they're considered essential. But in general, things are going smoothly. I think the town has done an excellent job responding to this, providing the information. Again, this is a medical crisis. It is about, it is primarily through the Board of Health nurse and those on the other end treating the patients. So, just to reiterate that. So yeah, that's what I have. I don't know if, if you have questions or, how you feel about how the response, what have you.
So if I may, through the chair, can I give you a little bit more of from emergency management perspective as emergency management director and the fire chief?
Sure.
So Casey's 100% right. We started about 4 to 5 weeks ago, meeting as a task force to put into place in case something happened. Now, we've been training for this forever, but how can you train for this pandemic? It's just crazy. And one of the things we decided early on was whatever information comes out from the town is going to come out as one message, as opposed to the Board of Health sending a message out and then the selectmen sending a message to the fire department. So what we do is, what we put into place is a vetting group. This vetting group consists of myself, the police chief, Chief Liver, the town administrator, and Casey. And anything that goes out, either on the internet or through any of our social media or whatever, is all vetted by the 4 of us before it goes out. That includes everything down to the daily or weekly updates that our clerk, Andy Dow, does. Now, Andy's doing most of the posting on the website. He's redeveloped a page, as Casey spoke of earlier, to give us an easier way for everyone to find what's going on. I'm dealing a lot as emergency management director with the Department of Health and with MEMA. I'm getting supplies from them, either PPE, personal protective equipment for first responders, or if there's a facility in town that is considered a critical facility and they need it, I also work with them to get them supplies. And some of the things we targeted early on was that we wanted to be sure that the vulnerable populations that we have in the town, the children and those over 65, are getting the services that we need. And as Casey mentioned, we had the senior center involved. We also have family and youth services involved. So they're very much involved in this. You can find their contact information right on the town webpage. You go to any department webpage and you click on COVID, it's going to take you back to the town webpage.
Right.
And what we're doing is we're ensuring that they have the food we need. The senior center is reaching out to them. These schools are processing food for the children that are on the list for who normally get free lunches or whatever. So the schools are taking care of that. So these are all things that we were attempting to deal with. We started to deal with 4 weeks ago. And I got to tell you, this pandemic, as you all know, has gone very rapid, right? It's gone from 1 million infected to 2 million in about a month's time. It's just crazy. And we've been trying to deal with that. I, as the emergency management director, have to take care of the EMD stuff. And I also, as a fire chief, have to take care of the emergency response stuff on that side. So most of our meetings, for the emergency management are, John heads them up. We have one tomorrow morning at 10 o'clock. Everything is being done this way, virtually, just because we don't want to
Yeah.
spread anything to each other, because that would be a bad thing, right? Casey's
Right.
been great giving us information. And what's really nice is, and Ann's been awesome. I can't tell you guys enough. When and if you guys haven't met Ann yet, hopefully at some point in time she can come. She has been incredible, because this tracing that Casey talks about is not as easy as it sounds.
Right.
So she gets a case and she's told 123 East Main Street has something. She now needs to find this person, find their contact information. Hopefully she can get it from the hospital. Contact them. Hopefully they could be at the hospital. It could be at home. It could be somewhere else. Then when she gets that, she has to find out who they've been in contact with for the last several days, reach out to all of them. So it's very intense, very manpower intensive, hour intensive. And she's done an incredible job getting this information. She gets it to Casey, and Casey daily keeps us updated. So that's just outstanding. Altogether, it's been a great team effort.
Right.
From the EMS end, we have, I was just mentioning this to the board, the selectmen last night. I've put out 19 updates in about a month of operational procedures. Now, each of those updates consist of probably anywhere between 5 and 10 actual updates. So I may send out update 1 that has 4 different things we're changing. Update 6, change those 4, and we're changing them to something else, because Public Health came out with, the Department of Public Health came out with something different, or CDC came out with different guidelines. The best example is that is when this all first started, we were all told N95s are all you can wear. Surgical masks don't do any good. Now we're putting surgical masks on all of our first responders, unless you're doing a procedure that causes aerosolization. If we're doing a CPAP, if we're intubating, if we're doing a nebulizer treatment, those require N95s on our personnel. Everything else we're running surgical masks. N95s are like gold. They're really difficult to get. We have about 350. The police have about 200. These changes have been coming along. So my guys are all now wearing surgical masks for the most part, but they're also wearing gowns and gloves and protective eyewear, either shields or whatever. And we're chewing through PPE like crazy. I said earlier before we started that our call volume's down by about 30 to 40%, but the calls we're going on are sick people. They're really sick people. Where people are waiting and waiting and waiting and then calling. So when we get there, they're sick. And we're doing, so we have 4 guys all in PPE trying to take care of this person. Now we're trying to reduce the number of people that are contacting them. So instead of putting all 4 in the building, I may only put 2 people in the building, or 1 person in the building. If the person can ambulate, they'll walk out. We'll put them in the ambulance and put 1 person in the back and try and maintain that contact, because we want to keep our people healthy. Now, right now, this is very important for the whole board to understand. Fire department's all healthy, police department's all healthy, DPW is all healthy, and the town hall's all healthy. Don't ask me how, but we're all healthy, which is terrific.
Well, thank goodness
because
for
of
that.
it's terrific. But because of that, when you see us out, you're going to see us wearing surgical masks, whether we're out doing inspections. Now, inspections have cut way down. We're not doing a lot of this.
Right.
We're doing primarily just emergency response and emergency inspection. We're doing everything we can to facilitate that and to keep us all healthy. It's been challenging. It really has been. I've run storms. I've run snowstorms. I've run hurricanes. I've run sleet storms. Not a problem. 3, 4, 5 days events. This is something different, I got to tell you.
Yeah.
But it's been a great team effort, and I'll be happy to take any questions any of you may have.
How many of we have 46 cases in the town, Casey?
Yes,
we
we have
have-
49.
49 cases.
Yeah.
And how many of those, Chief, have you had to go and, in a sense, rescue out of their house?
Yeah, we've probably, of those that of those 49, and interestingly, a lot of them we haven't transported. They ended up at the hospital themselves. Some
Yeah.
of them are at long-term care facilities in town. So we find out that they're there already and they're being treated or being quarantined there. But we've taken at least probably 8 to 10. And of those 8 to 10, some of them have been multiples per house. So in fact, we take one and it gets marked. So the governor made a requirement that public health department, you guys, need to tell us, first responders, the addresses of the people who are confirmed. That's
Right.
it. No names, no whether they're male or female, nothing. The only information we can have is their address. That address goes into our computer-aided dispatch. So when we get dispatched to 123 Main Street, one of three things is going to happen. We're going to get dispatched and we're going to have it pop right up on our screen that this is already a COVID positive location. So we're going to know that. Now we may know that that person's already in the hospital, so this is a relative. We've had
Right.
several of those that we've taken. In fact, we just had another one yesterday. So a husband or a wife or whatever, or children. So say, well, we're going to be back there because we know the other ones are sick and just don't want to go yet. So that could happen. We're going to hear from dispatch, be advised this is a negative response. So if you listen to us on a scanner and you hear a negative response, that's not a bad thing. That's a really good thing. That means they answered all the screening questions negatively. So it shouldn't be a COVID case.
Right.
We still take full precautions. We still wear PPE. What we don't wear is gowns. So gowns go only when we get the positive. So if we get a COVID positive or an unresponsive person, because if unresponsive, we have to assume, we don't know if it's a drug overdose or cardiac arrest, or we have no idea. We have to assume that's a COVID positive case. Then we do full PPE, which is face, eye protection, gloves, gowns, and we don't wear just gowns. Sometimes we wear full Tyvek suits and then a mask, depending on what level it is. So those are the three things that can happen. We have transported somewhere between 8 and 10 of the positive ones. Another one too, man, I would have sworn it was, and we got a phone call from the hospital telling us it wasn't. So like, good, that's a good one.
Yeah.
I just got a phone call this morning for another.
But what do they have? It's just the flu? Just the flu?
Yeah. It's colds, it's flu, it's and some of them, Mr. Chairman, I got to tell you, it's weird. We had one. We went yesterday for a lift assist. So this person had fallen, and this happens often. An older person living at home. I need help. I've fallen and I can't get up. So we go over, we help them up. And while we're en route, we're told it's a negative COVID, no fever, but the residence was a positive COVID because we know we had taken someone out of there already. So the guys did full PPE anyway, picked her up. She said, I'm fine, don't worry about it. Bye-bye. Talked to her daughter, left it there. 4 hours later, we got a call for a positive for the same address. Same person had developed a fever. And I got the call this morning, it was a positive. So that's the kind of stuff that our guys are dealing with. We're going in there, us police,
Just don't
DPW's
know.
out there working, and we just don't know. So it's quite a challenge, but
Yeah.
I can tell you that the men and women of all the departments are doing an incredible job holding up. So we're really proud of them all.
Okay.
So,
Go. I'm sorry. Go ahead.
so I had a question about isolation. So if you have been around a positive case, then are you all self-isolating for 2 weeks?
So, no, you mean as far as fire personnel or no? So
Or the first responders?
first responders. So here's what happens when we do a positive case. Okay, when we do our electronic PCRs, our electronic patient care reports, they go to the hospital. When the hospital, because they're automatically transferred, I don't have to do anything. They just go electronic. The infection control person at the hospital, when they get a positive, goes back and looks at our PCR and says, were they wearing their proper PPE?
Mm-hmm.
If we were, it's technically not an exposure.
Okay.
If we were wearing our gloves, if we were wearing our gowns, if we were wearing our mask, it's not an exposure. The scary ones are when this first started, excuse me, we walked into a case or two that it was, it's nothing. We walk in there and there's an elderly woman in there with a fever who's got this dry hacking cough, and the guys walk in with nothing. So that's why we've changed it for every call we go on. So early on, we did have 2 possible exposures.
Mm-hmm.
They were sent home to quarantine, and they were given the option, and I'll get back to what Casey said earlier about a residential place for them if we need to, but they were sent home, they were tested, they tested negative.
Okay.
So, but in case they do test positive, so if we have a failure in our PPE, which could happen, or we go for a different type of call completely, a fire alarm. Now our guys are even wearing masks and gloves on fire alarms, which we never would have done before. But let's say one of our guys does get it. So what happens is we have to quarantine them for 14 days. They have 2 options, because we don't know, as you know, Swati, how many people are asymptomatic yet carriers. What are they talking?
Right.
40 to 50% maybe, or somewhere around there. It's crazy. We don't know any of our guys could be asymptomatic yet carriers. So if they get exposed, they have the option. They can go home if they can self-isolate. So if they can go home, have their own bedroom, their own bathroom, have someone bring them food and stay there for 14 days and not go crazy, that's where they'll go. If not, we actually have reached out to the Boxborough Regency. And the reason I reached out to the Boxborough Regency was through connections in Fire District 14. I found out that they were actually making rooms available. Because some facilities don't want to do it. They just don't want us there. Boxborough Regency said, look, we're going to isolate this one wing. Anyone who's a first responder can come here for $50 for a night. Okay, so we signed it. We signed that memorandum of understanding with them that if need be, I pick up the phone, I call them, I said, I'm sending someone over. They don't even need to go to the front door. They go in through a separate entrance, right?
Right.
They'll make the
Wow.
room ready for them, go directly into the room. They'll be in the room. They can order their food through room service, which again, we will take care of. Now, all of those funds, as Casey said, he's got that money that will help
Right.
cover the upfront cost.
Mhm.
All of those funds when the president declared the state of emergency, excuse me, let me back up. When the governor declared the state of emergency, then Northborough declared a state of emergency, and then the president recognized those states of emergency. That opens up us for what's called the Stafford Act, which is a FEMA reimbursement of 75% of our costs.
Hmm.
So what would happen is we get to track all of our costs, and at
Right.
the end of everything, we submit these costs. Now, I don't know how many of you deal with the government, but basically that means maybe 2 years down the road, we may get money back, but that's just what it's like deal. We get a big snowstorm, and a year and a half later, we get a deposit. What's that from? So that's our other option. So let's say if somebody, for me, it's not an issue. We have a bigger house, and I have my wife and our one daughter staying with us, but I can stay in a room away from everyone else.
Mhm.
Some other people have young kids at home.
Yeah.
If my one son, who's a type 1 diabetic, if he still lived with me, I wouldn't be coming home. You don't want to come home with someone who's immunocompromised like that. Or if you have elderly parents you're living with you, those people, we wanted to give them an option of going somewhere else. So they can go to the Boxborough Regency, stay there for 14 days. If they remain asymptomatic and they don't develop any, they don't develop any tempers or anything, they can come back to work after those 14 days.
Now, have you been tested, the first responders? And the police department too, they're right in on this.
That's a great question. So they have 2 first responder test sites in the state now. Initially, they had one, which was at CVS in Shrewsbury. Awesome, right? Except you only get 200 people in there a day. You could only get in there via an appointment, and you had to be symptomatic to go.
Right.
Initially, you didn't have to be symptomatic. And what happened is they were getting overloaded. Everyone was sending people there to get tested. You don't need to get tested necessarily if you haven't had an exposure or if you're asymptomatic. That's just the way it is. There's not enough. This is when things were first kicking off, right? So the way it's going now is I have sent 3 people. I had one guy that developed, he thought, I got dry cough and a tight chest, and I don't want to come into work. I said, I don't want to spread it. Hung up the phone. I called our 800 number. They said, send him to Foxborough today at 2:00. So Foxborough is our one testing site. The other testing site is at the Big E in West Springfield. It was initially first responders only. Now it's first responders. And believe it or not, the other group that's allowed to go through there are people that work at grocery stores, which makes
stores.
Makes perfect sense to me. Those people are exposed terribly, right?
Right.
So I sent him down. He got tested. It actually turned around in about 36 hours, which is awesome because even when we were first getting these turnarounds, it was 4 days, 5 days. It was terrible. Now they're turning them around a lot quicker so I can get the guys back to work so he didn't miss any work. So right now, the only ones we've tested are ones who, the 2 that were exposed and were asymptomatic. The one that was symptomatic, and by the way, he came back negative, which is awesome. And we haven't tested anyone else. And now they've gone strictly to symptomatic. There's just too many people. Every day I go into WebEOC, which is a web portal into the State Emergency Operations Center, and I check all the updates from all the Emergency Operations Center across the state. I look and see how many firefighters have been tested, how many firefighters are out sick, how many police officers, how many of this and that. There are about 500 firefighters off the job right now in quarantine. There's about 400 police officers throughout the Commonwealth out of work in quarantine because either they tested positive or they had a known exposure and have to go into quarantine. So every day we do that. We have been very fortunate. The 2 guys that were out, I only had to fill for, they left that day. It was like 2:00 in the morning. They got the exposure. So they went home. There wasn't actually an exposure because they walked in and walked back out. So in their mind, it was an exposure. And
Right.
and as at the very beginning, we were nervous, but it wasn't really an exposure. So we're doing very well with that. And now they don't have an option. If they go out that door, they're wearing their PPE. That's just the way it is. Causes us to burn through it pretty quickly. Luckily,
Right.
we have about 13,000 surgical masks, 1,300 surgical masks. Casey has another stock through public health. He's got some stuff there. We just got some thermometers from the no touch, the thermal thermometers you can put at the head, because we don't want to be touching somebody and then have to clean it off. And then there's another route of exposure. So things have been going very good for most things. And we're hanging in there and doing the best we can.
Okay. Yes, I'd like to make one point too is a more of a general point. With the Board of Health, I've been giving a lot of updates on what's going on, and I think there's a lot of chatter out there, throughout many towns about what health departments should be doing, or why aren't they doing what have you, and maybe Glenn can add a little bit on that. We are keeping the Board of Health is up to date. We keep in steady contact. There is recommendations not to go farther than the state recommendations, and that's something that's been I've communicated. I don't know if you want to add a little bit on that, Glenn.
I think we're following the guidelines of the state, who's working on this 24/7, and we've closed down the town as much as we can. It's up to everybody in the town to stay their distance. We're not going to shut down every single store because it's not shown. There's no scientific data to do that. I think that what we're doing is exactly what we're supposed to be doing. Everybody's on board. Everybody's working on the problem, and there's always going to be some ideas that pass through from the public, and we're certainly glad to listen to them at the Board of Health. But for the most part, I think you've done exactly what we're supposed to do.
And
dissemination of information. We're not supposed to be going to people's houses. That's not our position. That's not our it's not our job. Our job is to get the information out there, monitor what's going on, and follow the recommendations of the state. And if we wanted to change something, we certainly can. But I think the state's got particularly Massachusetts has a good grasp on this. I don't know why we got hit so hard. That's not, maybe somebody else knows. I've watched everything I can possibly watch on it. And it just seems, the only thing that bothers me is that if we've got 30 or 40% of the people are non-symptomatic walking around with it, that's a big number. I didn't realize it was that high. So, but what can you do with that? Stay the heck away from people, stay home, like everybody's been doing. And
wear a mask. And what people need to understand is when they're in public, and Governor Baker has asked them, and we've asked them, wearing a mask is not to protect you. Those surgical masks or a face cover now, because they're recommending either my daughter and wife just made some the other day, some of their own face covers with kerchiefs and stuff. It's to stop you from giving it to others with droplets. When we speak, when we cough, right? So it's not going to stop you from getting it. It stops you from giving it to others. Glenn, you're 100% right. That's what they need to do. They need to limit their trips to the grocery store to once a week. They need to wear a face covering. And we're not telling you not to go out and walk more. Go outside. It's been gorgeous. But 2 days ago it wasn't too nice, or yesterday was too nice, right? But today it was very nice. So you're right. It's frustrating, but I think what Casey's talking about, there's a lot of concern that maybe we're not going far enough. The Board of Health isn't going far enough. We're not giving out enough information. And one of the things I wanted to make clear, and I'm not sure, I don't recall Casey mentioning this, was the information we're giving out reference to people that are infected. We are not giving out addresses because we can't. We're giving out age groups. We're not going to give out specific ages because that's a violation of HIPAA. HIPAA is pretty darn strict, as those of you in the medical field know what we can and can't give away. It's pretty crazy. And we're being very careful, and we have had a couple. Unfortunately, we have had a couple people who have passed because of it in town, and we're being very careful with any information we're giving out with that as well, because it's just not appropriate to give that information out, especially at this time. And again, HIPAA comes involved in all of that.
Right.
Is that what you?
Yeah,
Casey,
and
let me ask, I'm sorry, Casey, what kind of concerns are you hearing from just general callers that maybe we can address?
nothing
Or
really.
what do they
I
want
mean,
us to do?
well, no one's saying, no one's saying that we should be doing this or that per se. I don't really get those kind of calls. The questions I get tend to be more about the business where they're working at. Maybe they have some concerns. Some of them are not really realistic questions about wanting information about cases and what have you. I probably get 3 or 4 calls. On my end, I haven't heard anybody complaining that we're not doing enough. I mean, there was one gentleman, for example, who I got an email saying that, he was upset they went into a business and they didn't have sanitizer. But again, those products are hard to find, and it's a recommendation. It's not, and it wasn't a big business, by the way. So,
Right.
you kind of get some people who are angry, maybe don't understand certain things, and I politely respond, saying why that is such. But I haven't, most people have been very positive with me, saying, thanks for, the hard work, and I'm sure, the chiefs and everybody, in town. I mean, we're doing, we're working, 7 days a week a lot on this, and I haven't had any issues with people complaining per se,
Okay.
but I do think in the bigger chatter, there is, a lot of towns it comes up, like maybe there's an expectation, but again, this is a medical emergency. This is not
Right.
the policies and directives are coming from the state, and our job is to stay with that. And it's even recommended that we don't go beyond that. It's this is the governor's recommendation, is not to go beyond that. So
Right.
we have enough, we have enough. And I think we're doing a fantastic job.
I think we're doing a fantastic job as well. It's a fairly large town. We got 49 cases.
Yeah.
So the people of
Yeah.
the town of Northborough are doing, their part.
One of
Yeah.
the things we're starting to hear whispers of, and I think this is where you guys are going to start hearing stuff as well, is where are we going in the future? How much are we going to restrict? So let's say if the governor says, okay, May 5th, we're going to open everything back up. I'm not saying he's going to do that, but let's say he does that. I
Right.
think there's some concerns from some people. Well, Northborough needs to be stricter and say, no, we're not going to, or we're going to do this. Well, and as you said, Glenn, we're following the directives of the CDC, the state Department of Health, and the governor. And I think that's really our best attack right now is to do that in the state. And again, we're not the only ones doing it. That's what all the communities are doing.
Yeah.
You just need to be careful to follow those and do and stay on track with that. And I think we're going to be okay. But I think I wouldn't be surprised to see some of that stuff start coming out.
Yeah. I think we'll watch and see.
Yep.
Nobody knows. This isn't something that's happened. So this is something we'll watch and see what happens and take it from there.
Yeah.
As you said, things you're
I'm sorry.
every day.
Yeah.
Your itineraries, Chief, are changing every day.
They are.
You're rewriting the book, and that's what we're going to have to do as well. And when
Yep,
we
I
get our
agree.
marching orders, then we'll decide.
I agree.
All right.
Any questions for me from any other members of the board?
I just want to say thank you to both you and Casey for all the hard work you guys do. I can't even imagine doing your jobs.
Yeah,
Thank you so much
I
for,
agree, Teresa. Good one.
Thank you. It's been interesting, and I have to tell you, the team, John is doing an amazing job at Town Hall, because he's not only dealing with this, he's dealing with where are we going forward with the town, and and everything, and dealing with all the budget stuff, and yet still worrying about trying to get people fed and making sure everyone's getting to that. And then you got the police chief, he's dealing with stuff, and it's just amazing. And there hasn't been one there hasn't been one sandbox issue. You know what I mean, Teresa? There hasn't
Yeah.
been one issue of no, that's my thing to do. It's all been working together, and it's just amazing. And I really appreciate those kind of people.
You guys have,
Fantastic.
you really have. It's, and when I go out and, you know, my office is downtown. I live 3 miles from my office. It's quiet. Kids are not playing together at the school anymore like they were after the first couple of weeks. And, you know, people are, when they're walking on the street, they're keeping apart from each other. Everybody's wearing masks. You guys are giving all the information we need, and you're doing a great job at doing it too. So thank
Yeah.
you.
Yeah. Like I said, it's definitely been stressful. But you know, we're hanging in there, and I think we're doing an excellent job. That's really, you know, I don't know if anybody has any questions for me. Like I said, I've definitely been keeping everybody in the loop that I need to. And I think we're doing a fantastic job, and we're taking the recommendations as we're supposed to.
No, I'm glad we had this meeting because this is a good thing to get updated and caught up. So I think I appreciate having the Board of Health arrange this so that we can do this, and to keep socially interacted and keep ourselves up to date on what's going on in the town, in our town, and make sure if there's anything that we need to do,
Right.
you know,
Yeah.
then we can act upon it. Because if you don't hear about it, you know, it's like not. And every so
Yeah.
often I'll bump into somebody, or somebody will call and say, "Hey, what's the town doing about this?" I was like, "Well, okay, yeah, we're having a Board of Health meeting. We'll find out," you know.
Right.
So you
I
always
would
get those people.
encourage anyone on the board that has any questions, call Casey, call me, call the town administrator. We're here for you guys.
Right.
One
You
thing
know,
I'd like to, I'm sorry,
Go
one
ahead,
thing I'd
Casey.
like to add is when this initially happened, there was some chatter out there about, oh, maybe we should isolate the town, or you know, there's some communities on the Cape or what have you. But that really, it never really came to be. I mean, it just kind of, it was initial thoughts, like these more extreme actions, but they really just went away when the you know, with level heads prevailed,
Mhm.
and we went through the guidance for the state and the governor's office and what have you. So you know, yeah, that's kind of my last, you know, my last point to make. And anybody have any questions for me?
I think we're all good.
I'm good.
The
Okay.
website is really good, Casey. Good job.
Yes,
All right.
I agree, Swati. The website's fantastic.
Yeah, I mean, it's been stressful, and of course, you know, for 20 minutes before the meeting, couldn't get tried, you know, 20 times to get the camera going, but at least I got my audio. I just don't know what happened. I
Yeah.
tried every which way.
Yeah, we got you in. That's all that matters.
Okay.
Yep.
Yeah, so I guess we'll go to our last, you know, just established tentative future date for May 12th, 2020. You know, close out the meeting and what have you.
Yep.
Chairman.
Well, I move that we adjourn the meeting for this evening. And if we need to, we'll pick up again. Either May
All right, very
12th
good.
or before then.
Second.
Okay.
Second it.
All right. Thank you, everybody.
Thank you.
Perfect.
All right.
Thank you.
Thanks,
Bye now.
guys.
All right.
Stay safe, everybody.
Thank you.
Thanks, Gene.